Miss Gaines. My name is Sarah. I'm here to help educate you on how you're going to give your antibiotic at home. Would that be okay? Can you tell me your name and date of birth?
Lisa Gaines, 42294.
Do you have any allergies? Okay. Do you have any questions before we get started? Okay. First, we're going to turn the pump on. Let it start powering up. To give your antibiotic, you're going to need 2 flushes because we're going to flush your PICC line before we give it and then after we give it. And then you're also going to need your vancomycin, 1 gram, that the pharmacy should send to you. And then your IV line, as well as some alcohol pads so that we can clean your PICC line before we connect to it. You'll have an IV pump at home, and when it asks if you're a new patient, you'll just hit no because it will be programmed for you. And then we're going to select our channel A, which is going to be on this side. So we're going to go ahead and we're going to prime our IV line here. You're going to do that by removing the ends of the line and the bag. Unclamp it and let the line fill up all the way to the tip. And then we're going to clamp it back. So once your line is filled all the way to the tip and you've clamped it back off, we're going to insert it into the pump. You'll pull up right here and the door will open. And then you're going to insert this at the bottom where you can see it fits. It clicks in there. And then this fits into the top right here. And close the door back. Okay. We're going to select Guardrail drugs. Then we're going to go to vancomycin. And we're going to select the vancomycin, and we're doing 1,000 milligrams and 200. So we're going to select that, and we're going to verify that's correct. Then we'll confirm it, and we'll enter our rate that's ordered and the volume to be given. And we usually set that a little bit less, that way it doesn't run all the way out and you don't realize it's almost out. Okay, and I'm going to go ahead and pause it so that we can do your flush. So when you go to flush, you'll just want to take your saline, you'll pull back and then push up until you get all the air out of it. Then we're going to remove this cap and we're going to clean. You don't feel any pain or anything with that? Okay. And you always want to, if you feel any pain or anything, stop pushing. And you always want to watch for any swelling or redness. So now that that's in, we're going to connect your antibiotic to it. You want to make sure you unclamp it. And then you're going to restart to start your pump. So now the pump is running, and you should see it dripping so that you know that it's running and it's going in. But for this purpose, we're going to go ahead and pause it and stop it, and I'm going to show you how to disconnect it. You're going to clamp, and then you'll unhook the antibiotic antibiotic when it's finished. You're going to scrub the hub again. Make sure you get the air out of your saline syringe. You're going to flush it. Does that feel okay? Okay. Once we've flushed it with that saline, we'll unhook it. And then we will put a clean cap on. Okay. You have any questions? Okay. Would you like to show me how you're going to do it when you get home? Okay. All right. Are you going to be the one helping Miss Gaines at home?
Yes.
Okay. Are you ready to show me how you learned to do it? Do you have any questions? Okay. All right. Well, I'm here to help you if you have any questions.
First, I'm going to inspect the bag, inspect the expiration date, and make sure that it's not expired and there's nothing inside. It looks good to me. So then we're going to crown the tree. We have to make sure there's no air bubble in this spot here.
Right. So sometimes if there is, you can flick it and it'll move the air bubbles on out. See them moving up. Okay.
Can you please
You need
stop?
some help? Okay, I'll get you some. Pull straight up. There you go. I always lock that bottom in first, yep. Yep. And then you'll always want to flush it before you.
Hello. My name's Dylan. I'm another nurse. I know you just talked to my friend Kendra about insulins and checking your sugar and all that good stuff. You're newly diabetic is what I hear. How are we feeling about that? I know it's scary.
Overwhelming.
A lot to take in.
Yes.
I I'm just going to talk to you a little bit about diet, easy way to kind of make sure we're doing the things we need to, and not so much the things we don't control our blood sugar, right? And I brought with me a plate here.
Just hit back. You didn't go to the V's. Hit back. Yep,
This is
U to
called
Z.
The diabetes
Yep.
plate. It kind of
Vancomycin.
just
Oh,
breaks
go
down
back again.
The serving sizes that you need with each meal to help keep your sugar in check. And with
U
each
to
meal,
Z.
half of your plate
The second ones. Yeah, there you go.
non-starchy
Non-white.
vegetables, those would be things like chicken,
And then she's, yeah.
broccoli, cauliflower, things to that nature that's really low in carbs. It's
Job.
not gonna raise your
Now just make sure
sugar.
everything's
And
unclamped before you
your
hit
plate
start.
needs to be carbohydrates. So we would have things like whole wheat bread,
Okay,
starchy
next.
vegetables like corn, and then a quarter of the plate needs to be proteins. And we want to do lean proteins, not the
Yep.
fatty ones. The fatty ones will raise the blood sugar.
Yep.
So those would be things like fish, seafood, baked chicken, and we could even have like wing steaks. things
So
like
it's
that.
green,
Okay?
and you should see it
And then I've brought
dripping,
some foods here with
which
me.
means you started
What
it
I want you to
correctly.
do is kind of just identify.
It's okay. It does that. It's got a little air in it.
That makes sense.
So you can just pause it and open your cup.
Vegetables, very good.
And you just inspect it and make sure there's no air in it.
What's one thing about corn? It tends to taste very sweet. Very sweet. Corn is actually a starchy vegetable, so it would go along with our carbohydrate. I have a piece of whole wheat bread.
So now you're dripping.
Yes.
So you can go ahead and pause it, and we're gonna discontinue it to see how to flush it at the end.
And baked chicken. All right. And can you tell me, what's one thing that you think we would maybe eat for dinner that you think would fit this plate? Just for an example, just so I know that you understand. All right, I mean, that sounds really good to me for a dinner choice. And we also have to think about the things that we're drinking. A lot of times we drink calories, lots of calories, and we realize it, or really things that are really sugary that we don't think about. So we need to make sure with our drinks that we're either drinking water or 0 calories, 0 sugar. And you can even have things like soda, but we would need to make sure that's diet. And for 0 sugar. So is there anything that you'd like to
All
drink?
right. Do you have any questions? Miss Gaines, do you have any questions?
How can I tell if it's infected?
You'll want to look at it every day, and you'll want to feel it and feel if you feel any warmth or you see any redness or any drainage around it, then you'll want to definitely notify your provider.
I know it would be an adjustment to make, but we need to really be doing that.
Any other questions?
Is that a change you think you could make?
Okay.
Oh, do you have any more questions?